Hello, I'm Fergus Shanahan, and welcome back to The Language of Illness, a series of brief presentations based on my book of the same title, The Language of Illness, and published by Liberties Press. In previous episodes, we've looked at the distancing effect of medical language on the doctor-patient interaction and the interaction of patients with their carers. Now we turn to the words that patients care about, the illness words. In this episode, we will comment on the illness words. Words that are important to patients, but which are often obscured by medical speak. In the introductory video, we distinguished disease from illness, disease being the objective evidence of a problem, whereas illness is the lived experience of disease. In contrast to disease, which is black and white, illness is coloured, nuanced, individual, and deeply personal. We also pointed out that if language is exclusively focused on disease, it separates or distances the patient from the carer and denies a voice for the patient. This has contributed to the rise of illness memoirs, which have become an established literary genre in recent years. These vary in quality. Many deal with triumph over adversity, but for some patients, illness is predominantly about continual loss and disruption. For others, illness does not conform to a typical narrative and is chaotic or non-linear and not adequately served by the typical illness memoir. Therefore, I have taken a different approach in my book and have mined a multitude of memoirs for the illness words used by patients and important to patients. And I've analysed these words, which are shown here. Now, we don't have time to cover all of these words in detail, but I'm particularly concerned with how the attitudes and actions or inactions of others may compound the ordeal for those who are ill. As I show in my book, the behaviour of others may accentuate or mitigate the suffering reflected by the illness words. One of the illness words is, for example, waiting. There is much that could be done to reduce the waiting experienced by patients, waiting for a diagnosis, waiting for a specialist, and then another specialist. As noted by Anatole Boyard, who died from prostatic cancer, nobody, not even a lover, waits as intensely as a critically ill patient. One can see the illness words on the faces and in the body language of those who wait in a doctor's waiting room. Fear and anxiety. A mixture of boredom, powerlessness, and uncertainty. And then there is the loneliness and aloneness, which may be exacerbated if friends and acquaintances stay away because of a feeling of awkwardness or inadequacy. One of the cruelest burdens for those with chronic illness is the possibility that they will not be believed. This is particularly the case when illness presents with lots of symptoms but without any objective evidence or signs of an abnormality that a doctor, nurse or other carer can see. Some disorders are associated with few signs and lots of symptoms, whereas others have few symptoms and lots of signs. Of greater concern is the fact that if one has to prove that they are ill and required to play a sickness role, they are less likely to get well. This was of great concern to Charles Darwin, who suffered from disabling symptoms for most of his life and consulted over 20 doctors but had no signs of abnormalities, no physical evidence of disease. And he worried that sooner or later people would not believe him. The disparity in symptoms versus signs of an abnormality may add to the patient's burden of the deeply unfair and inappropriate judgments that others may take. One of the reasons why patients may try to conceal news of a serious diagnosis is because they anticipate awkwardness on the part of others. Alan Bennett, the English playwright, recalled his sense of shame and even failure after attending for a colonoscopy and was found to have a cancer, but was conscious of the change in behaviour of the receptionist who was clearly aware of the finding and would not look directly at him as he tried to pay his bill. A more disturbing account of the attitude of others when a friend or colleague is diagnosed with a serious illness came from a doctor. This was the story of Dr. David Rabin and his family writing in the New England Journal of Medicine almost 40 years ago, and in a subsequent book published by his daughter. Rabin was a 45-year-old director of endocrinology at a famous American medical center at the time when he developed motor neuron disease, a progressive degeneration of muscular function. Once he was diagnosed, he noticed that his colleagues changed, became awkward and avoided him. Previously sound relationships faded. And then, one day, he fell. And the moment is as chilling today to read of as it was almost 40 years ago when I first came across his words. One day I fell. A long-time colleague was walking by. He turned. Our eyes met as I lay sprawled on the ground. He quickly averted his eyes, pretended not to see me, and continued walking. The full range of illness words is analysed in my book in greater detail. And this, of course, is important for anyone who cares about caring. That's it for this episode. Join me next time on The Language of Illness when we look at a different aspect of the entire topic of how patients interact with their carers.